Thank you for joining us on this Monday. Happy Monday. As usual, there's a lot to get to for our first coronavirus briefing of the week. Mayor Demings is going to be giving the latest in coronavirus numbers and update the latest on our strike teams. Mayor will also talk about CARES Act funding for the Eviction Diversion program, the portal reopening for CARES for individual and families, and update the latest testing numbers. Unfortunately, Orlando Mayor Buddy Dyer won't join us today because the City Council meeting is still ongoing. But Dr. Pino is here, and he'll help us understand the latest data. He'll also go over new CDC guidelines on quarantine. And Comptroller Phil Diamond is also here today to give the tourist development tax collection numbers for the month of October. Mayor Demings.
All right, thank you. Good evening to all of you. Hopefully you had a good weekend. Before we begin today, let me just talk a little bit about National Pearl Harbor Remembrance Day. I want to take a moment to honor the memory of those who lost their lives on December the 7th, 1941, 79 years ago today. 2,043 Americans perished during the attack by the Imperial Japanese forces on Naval Station Pearl Harbor, marking the United States' entry into World War II. Locally, the Dory Miller Memorial Post of the American Legion held a wreath-laying ceremony earlier today. Mr. Fred Robinson from the Orange County Veterans Advisory Council attended the wreath-laying ceremony on my behalf. I would also like to thank all World War II veterans for their bravery and patriotism. So as we begin now, let's talk a little bit about where we find ourselves in the battle against COVID. My goals of the week continue to focus on slowing the spread of the virus here within our community. We will continue this week to offer another chance for financial assistance to individuals and families tomorrow. I'll talk more about that in just a few moments. We will also continue to offer free COVID-19 rapid and PCR testing through Orange County Health Services to anyone who needs it. And lastly, this week, our strike teams will continue to inspect and work with the Orange County businesses to ensure that we have compliance with CDC pandemic standards and the various executive orders. As we talk about the numbers, just remember that these numbers represent real human beings and families here within Orange County. There are now 62,041 coronavirus cases in Orange County. That is an increase of 571 cases from yesterday and a substantial increase of over 1,600 cases since our last briefing on Friday of last week. Our 14-day positivity rate is 6.3%. We now have 658 Orange County residents who have died as a result of the coronavirus, which is an increase of 7 residents who died since our briefing on Friday. We send our deepest condolences to the families of those who have died. And Dr. Pino will have more on the numbers momentarily. In terms of the testing, we endeavor to make certain that anyone in our community who wants to be tested can do so free. At Barnett Park, Orange County Health Services continues to offer the free 7-day-a-week testing from 9 a.m. to 5 p.m., 9 a.m. to 5 p.m. We encourage testing in order to slow the spread of the virus. Our team can administer 2 kinds of tests at that location: a rapid antigen test and a PCR molecular test. You can get either test at that location, or you can take both. Many people who go decide that they want the immediate feedback within 15 to 20 minutes of taking the test, or the PCR, which is the one that is more invasive, that goes into your nasal cavity and into your throat. That test results come back within 48 hours. And so many of our residents are availing themselves of either or both. From Friday through Sunday, Health Services administered 4,364 tests. Nearly 3,200 of them were rapid tests. For more information about testing, you can go to our website at ocfl.net/testing. As a reminder, our Orange Cares grant program for individuals and families will open its online application portal again tomorrow at 8 a.m. Thank you to the media who have been working to spread the word about this opportunity for families and individuals to receive financial assistance. We will open up the portal to as many as 20,000 residents in order to apply for $1,000 grant funds. After the portal closes tomorrow, our team will assess whether we can reopen it again. We have to consider whether funding will be available before the December 30th deadline established by the federal government. For those who were denied in the past or had a duplicate application and were denied, you are now eligible to reapply. Again, applications can be made at ocfl.net/orangecares. Now let's talk a little bit about our eviction program, our eviction diversion program, I should say. This program is designed for landlords and tenants who will apply mutually through Wednesday, December the 16th. Applications will be processed, even though they can apply through Wednesday, we'll continue to process them through December 24th in order to get them to the comptroller's office for payment before the December 30th deadline. So far, nearly 2,200 Orange County families have been able to stay in their homes thanks to the CARES Act monies. $6.7 million have been paid out through the comptroller's office to landlords on their tenants' behalf. Some members of the Affordable Housing Advisory Board have been holding informational sessions to show both landlords and tenants how to apply for the rent relief. There will be 2 more sessions planned this Friday and Saturday at the Kingdom Church located at 800 North Pine Hills Road. Again, this is the purpose of these meetings will be to assist residents with applying for the eviction diversion program. And I know there's a lot of interest in our compliance or strike teams and the work that they've been doing. Our strike teams have now visited over 5,600 businesses with a 98% overall compliance rate. 737 businesses have been re-inspected with over 80% compliance. Our teams did not go out this weekend. Rather, they spent the time putting together the protocols to carry out the executive order that I signed this past Friday. As you know, that executive order calls for penalties for businesses that don't enforce mask or social distancing guidelines. The teams will be out tomorrow morning to issue possible warnings and citations. Let's just hope that the few repeat offenders, as you all know, I call them the bad actors, shape up and take measures to slow the spread of COVID-19 in our community. We also announced this past Friday that our Orange County Animal Services will hand out more than 3 tons of free pet food at the South Econ Recreation Center on this Wednesday. The giveaway will begin at noon, and it is on a first-come, first-served basis. In keeping with proper COVID-19 social distancing protocols, this is a drive-through event. For more information, visit Orange County Animal Services Facebook page, Toy Drive Update. Now, I'll share with you the update. We've had a tremendous turnout so far this year for the Mayor's Toy Drive. I want to remind residents who are still looking to give that the online shopping portion of the Toy Drive ends tonight at midnight. That doesn't mean that you can't still drop off toys. So far, over 3,500 toys have been donated, and that number is growing as county staff picks up toys and gets them over to our holiday warehouse to be distributed to needy families. If you're looking to participate in the toy drive, you can do so online through 11:59 p.m. tonight, or drop off a new unwrapped toy at over 20 drop-off sites across the county by next Monday. To find a site near you or shop online, again, you can visit our website at ocfl.net/toy drive. And with that, I'm going to turn it over to the comptroller at this point, and then we'll go with Dr. Pino. Comptroller Phil Diamond.
Thank you, Mayor Demings, and good afternoon, everybody. I'd like to echo the mayor's comments about Pearl Harbor Day. It's been 79 years ago, I think, and I also want to recognize the people that died that day, and also my stepfather, who actually served in World War II, not at Pearl Harbor, but in the European theater, and it's always good to recognize our veterans and what they've done for us. So with that said, I'd like to announce the collection figures for tourist development taxes in October. And in the month of October, we collected $7,701,500. That's about a 69% decrease from last year's numbers. However, on the positive side, that is the 6th straight month of increase since we hit rock bottom in April of this year. But again, the numbers are considerably lower than they have been in the past. In fact, October is the first month of our fiscal year, so it can often set the tone for the rest of the year. And as far as October collections, this is the lowest October collections number that we've had since the October directly following the September 11th tragedy in 2001. On the screen, you'll see a chart showing our tourist development tax collections. The blue bar is October's numbers, and red, of course, is last year, and green is the year before that. So as multiple vaccines have shown very promising results in late-stage trials, and as we optimistically wait for final approval of the coronavirus vaccine in the coming weeks or hopefully coming days, there finally seems to be a light at the end of the pandemic tunnel. In the meantime, however, we are still months away before the vaccines will be widely available to the general public. And until then, our region will continue to face the many challenges associated with the pandemic. So while much of the pandemic is out of our control, we can still all do our part by wearing face masks and practicing social distancing to keep ourselves, our families, and our visitors safe. This is the one thing we can all do to help our economy, our neighbors, friends, and families. And I think it's a real testament to Orange County and our leadership that our positivity rate has remained as low as it has, especially in a tourism-based community where people are coming from a variety of destinations. I think that's really come clear in recent days as we've seen very high positivity rates around the country. On the expenditure side, the county continues to use TDT reserves to offset ongoing TDT collection shortfalls and meet funding obligations. The county has used a cumulative total of $88.7 million in reserves since April. For the month of October, reserves decreased by $24 million, as shown in the information in our press release. The majority of these expenditures were for capital outlay at $9.2 million, funding the 30-day operating and maintenance reserve at $7 million, and paying $5 million of Orange County's remaining $20 million commitment for renovations at Camping World Stadium. Finally, we will release the November TDT collections report in early January. I'll be happy to take questions during the question and answer period. Thank you.
Good afternoon. Thank you, Mayor. Thank you, Phil. As we approach the holidays, it is critical that we keep this in mind. Our holidays are not going to be what they were last year. It can't be. The celebrations cannot be the same. And they cannot be the same because that's the one that we want to have next year. And to be able to have everyone in next year, we have to protect everyone this year. And if someone cannot be there for whatever reason, it should not be because they die of a preventable disease. We can't prevent people from acquiring COVID-19. Our recovery rate continues to be around 92%, and we have 650 deaths. There were 7 additional deaths added to our roll since we spoke to you last. 51 to 88 years old was the range. 4 female, 3 males, 1 Asian, 1 black, 3 white, and a person of multiracial background. Ethnicity, 6 non-Hispanic, and 1 unknown. 6 have underlying conditions, 1 we don't know, and 4 of the deaths occurred in August. 3 of the deaths occurred in November. So as you can see, our numbers continue. I'm going to show you some of the numbers. Our numbers continue to perform well, but it's critically important that we continue to adhere to Cdc guidelines, to the point that during the holiday celebrations, people should consider using masks indoors, at home, when we have gatherings, and also specifically to protect people with pre-existing conditions and over 65 years old. So as I want to point here, last week, and this data is preliminary because it keeps changing every day as we clean the data, but last week we experienced a 14% increase in the number of cases when you look at the prior week. Last week, that ended on Saturday, we had 3,095 cases in our county diagnosed. Next. Oh, I have it's me. So, this is the average number of cases per week. But let me show you a little bit more in this data over here. And this is the positivity rate by week. And we have seen an increase. Although we remain very stable overall, and you can see that we are starting seeing increases in our data that I'm going to show you. They are minor, but they are significant. Why they are significant? Because this pandemic explodes when it's going to transmit. It goes from 51 days, and you get up next day and you have 200. And you get up next day and then you have 800. And this is very important, that we are here to CDC guidelines now to prevent what is happening in other parts of the country. Now, this is our rolling positive rate average testing. This only includes PCR testing. And here you can see our slight continued increase over the past few days, very slowly, but constantly going up. These is our cases. These are our cases on student age 5 to 17. And this is a rate. This is how we calculate it based on population. And this is a more accurate than just simple count. And how it's calculated because it takes into consideration the total population of the county. And after a little decline last week, we continue to see the increase that progressively we have seen in 5 to 17 years old. Not necessarily these are all in school, but many are in our public schools. And the same for adults, for the population at large. This is the entire population of our county, and that is our rate. It continued to increase slowly. And then you said, anyone can say, well, our hospitals are stable, which they are, and we have ample dispositional beds. But even there, as slow as it is, we continue to see an increase in the total number of hospitalizations. Now, we also are going to look, because many times we talk about importance of ICU beds. And then even for ICU beds, although the increase is slow, we continue to see an increase. And this is a scary figure that I'm going to give you. About 50% of the people who are in ICU bed around the country, when you look at the totality, will die from COVID-19. And that's a very, very high rate. You know, although people who go into ICU most of the time are gravely ill, so this type of outcome could occur, the percentage of 50%, that's very high. And here is also, in blue you have our daily numbers, and then the curve shows the death that we have experienced. And this is what I want to call people's attention. What we have here right now is what we had here before the increase in the number of deaths occurred in Orange County, and it happens everywhere. This data follows the increase in number 3-4 weeks after. So we should try to maintain, we are very, very stable in this data. Although any single death is a tragedy for any family, friends, and the community, we, in the last week, only since Friday we talked to you, we only have experienced 3 that have been reported to the department. More could be reported later. But this is quite significant that we are at this level. We have worked very hard, very, very hard with assisted living facilities. The state has invested a lot of resources to try to prevent major outbreaks in long-term care facilities, and we have achieved it. We don't have any major outbreak in any long-term facility in Orange County at this point. And it's also important for all assisted living facilities to register the state for the distribution of the COVID-19 vaccine. Of the 159 facilities that in our county qualify for that, only 1 has not registered. So I encourage those administrators of that small facility with 5 residents to register. And we will be visiting, and I will be calling you. Now, this is the new CDC guidelines. And with that, for quarantine, and this only applies for quarantine and quarantine only. It doesn't apply for isolation. So the difference between isolation and quarantine, isolation is a person that is positive, quarantine is a person that has been in contact with a known positive. And to prevent the spread, we are placing that individual on quarantine. Also, these changes in the quarantine do not apply to assisted living facilities or people who work in assisted living facilities or are in contact with people of high risk, meaning 65 years old with pre-existing conditions. Now, with regard to the schools, we have a group of students in quarantine at home from the school system. Although you may hear news here that may apply to you, please do not leave quarantine. Do not go back to the schools until you receive communication from us on the school that it's okay to go back. Why are we doing that? Because there is a large number of people that may be able to return to school, but we would not like a massive exodus from quarantine that we cannot control the flow of individuals coming back into school. So we are in process of looking at all that data, looking at all those individuals, and to be able to determine who can go back to school earlier. I'm going to explain a little bit here. It's confusing, and we will explain over and over and over again. So people who are in quarantine, we originally will tell you stay home 14 days after they establish contact with a positive individual. That continues to be the gold standard. That continues that most people should wait 14 days if they can wait 14 days. So that's the gold standard. But the CDC, based on data, and all the data is on the release from the CDC, and I think I mentioned to you before that we have a very low conversion rate from the people that we are sending into quarantine from the schools. that meaning very few people convert, and mostly convert in the first week. So this data kind of follows that too. So the recommended quarantine is the 14 days from the point of contact with the individual. Now, there are two different options right now. First, a person at the 10 days without symptoms. 10 days without symptom. A person at the 10th day without symptom can go back to work or school without a test, if they choose to, and if they have the condition to do so. It's also advised that those individuals, even when they return to work or school, monitor their symptoms for the 4 days remaining of the 14 days quarantine that was initially assessed. Now, there is a second choice. If by the 7th day you don't have any symptoms and you have a test that is over here, what is the point? Over here. You can go back with a test result that is negative. The test can happen in the 6th day. At the 7th day, if the test is negative, you can go back. We advise that that test must be a PCR test. Why? It is the best test that is out there right now. It's a little bit more expensive than the other, but it's the best test. Those are the guidelines for quarantine and isolation. The quarantine specifically, newly released by the CDC. Let me repeat that. And I want to repeat this. If you are in quarantine right now, do not leave quarantine until you get a communication from the health department of the school system, and this is specifically for schools, that your child is okay to go back to school. Why are we doing that? We want to prevent a speedy exodus from quarantine without any control, because we don't want to bring virus back to the schools. So we have to be sure that that's the case. Individuals with no symptoms that are in quarantine at the 10 days can leave the quarantine if they choose to do so without a test result. It continues to be the gold standard that it would be the best practice to wait 14 days. But if you decide to leave quarantine at the 10th day, you should monitor your symptoms for the next 4 days. I will advise twice a week temperature check. Now, people who want to leave the quarantine at the 7th day because of work or because you are an essential worker, whatever the reason may be, you can if you have a negative PCR test at the 7th day result. It can happen, the test can happen at the 6th, not at the 5th day. The test can happen at the 6th day. You can leave at the 7th or after that. That's the simplest way to put the quarantine. There are a lot of small nuances in the system, but I think that's the best way to illustrate to the public. With that, I would be happy to answer any questions. Thank you.
Okay, thank you, Dr. Pino. Just as a reminder, I want to make certain that we introduce some of the people that's in the audience here that may be able to respond to any questions. We have Orange County Commissioner Maribel Gomez-Cordero, who has joined us. She's fluent in Spanish. We also have Ms. Ilia Torres. If there are any questions for Spanish-speaking media, she will assist with the translation. We have Mr. Scott Howard from the Orange County Public Schools, who is here. We also have Ms. Diane Arnold with Orange County's Family Services Department, who is here to answer any questions related to the opening of the portal. We have Mr. Mark Tester, the Executive Director at the Orange County Convention Center. And so Tim Boldig, I thought I saw Tim in here earlier. If there are any questions regarding the compliance of the strike teams, we may call on any of them to assist with responding to the questions. With that, I'll open it up now to any questions of any of the speakers who are present at this time. Ms. Lauren
Mayor
Seabrook.
Lauren Seabrook, Channel 9. My question's for you today. In regards to the strike team going out on visits tomorrow morning, you mentioned, can you talk about if those are visits that are based on some new complaints that have come in since this executive order? And if so, maybe what kind of complaints and if they've been directly tied to the order?
Yeah, we will have our compliance teams going out to regular businesses that are open during the daytime hours, but they also will go out and focus on some of those nighttime types of businesses such as bars, et cetera. The team has certainly looked over the last few days at the complaints that we have received, and so they have a game plan of how they will proceed without telegraphing where they're going to be or what specific businesses. They will enter the business and produce appropriate credentials for the management of the business, and then they will proceed to do their inspections. Okay. All right, other questions?
Question from Wesh TV, Greg Fox. Mayor, I know that this is a process that is gradual to ramp up because you want to make sure that you have, I guess, proper evidence to find somebody. Do you anticipate that's going to happen this week? And can you tell us a little bit more about that process now that the executive order's been signed, the paperwork is in hand, and you're ready to go?
Yeah, obviously, we have been out in the community for weeks, months now, and we have visited and inspected certain businesses. As you heard earlier, about 98% of them have been in compliance. When we go back and do the re-inspections, about 80% of them are in compliance. That means that 20% have remained out of compliance. So that gives us a starting point. Some of those businesses have been re-inspected multiple times. So we're not going to wipe the slate clean as if they had not been out of compliance. So the team that Mr. Boldick has will use that to move forward. Again, our ultimate goal is to gain compliance, voluntary compliance, without having to penalize a business with a fine. But if a business is insistent, generally speaking, what I said on Friday was that the directive that we have given to our staff is we want them to be consistent in their enforcement strategies. And generally speaking, if you hit the magic 3 strikes, 3 times, you're likely going to be out. We will begin the process of issuing a fine. The fine can be up to $500 for that initial violation, and it could escalate from there if a business then remains out of compliance. So our compliance teams have worked diligently over the weekend to make certain that they have a whole operational plan of how they will gain that consistency and move forward.
Steve Hudak from the Orlando Sentinel. This question's for you, Mayor, but it also might be for Dr. Pino and Mr. Boldick. We've talked frequently about the bad actors, the people who have repeatedly violated or not heeded the mandates. Do we have any evidence that there are outbreaks or cases associated with those businesses? I get asked that all the time.
Yeah, that's a question. You remember the Florida Department of Health, they're the keepers of the numbers, the specific identifiers of individuals who have tested positive. We wouldn't specifically know who is tested positive, but there is, what Dr. Pino does is alert our staff, appropriate staff, if there is a specific location where there's an outbreak. And so it's probably best that we ask Dr. Pino to do that at this point. And then, Tim, you can make your way forward if there's any follow-up to how you all handle complaints, if you will, that come in.
So in some cases, yes, we have that hard data. In other cases, it depends on the type of business. For example, outdoors, small recreational amusement park, it's very difficult to pinpoint cases because normally people who go to amusement parks, they go to multiple parks in the same day. So that's a reason. The same happens with bars. Sometimes we specifically can point it because we got lucky and be able to identify the individuals and at a place once all together. So place, disease, and environment. But it happens also that sometimes people go bar hopping. So it's very difficult then to establish exactly which place. But in some cases, yes, we have hard data on some of the violations that had happened, and it coincides with some of the transmission that we have seen in some other places. Yes, the answer is yes.
And Tim, if you want to come up and talk a little bit about how you all triage the complaints once you receive them, and then how you assign them out.
Certainly, we do a lot of proactive work out there to get to the businesses, but we also get a lot of complaint-driven aspects as well, whether it's through our COVID email hotline service and actually emails that come in. We put those on the list. We follow up with them. And we're looking for compliance. I think that's the main thing that we're trying to do here is I think we don't want to be out there finding people, but or businesses, but certainly we want to get voluntary compliance, and we're about 6 months into this thing. So I think that's the ultimate goal, is trying to get that compliance in there. But we'll follow up on any complaint that winds up coming in for sure.
And so, Steve, finally, I don't know if someone will reach that pinnacle where they actually get a fine this week or not. We hope that no one reaches that pinnacle. And through compliance, they certainly can avoid that. And other questions?
Mayor, I have questions that were texted in. The first one is from Sierra Putnam with WFTV. 2 questions. One is for Dr. Pino. The other is for OCPS, for Scott Howitt. For Dr. Pino, it's our understanding that Winter Park High School is considering having a homecoming parade and dance in January. Do you think it's safe? What safety precautions would you want to see in place for a dance?
So that's a very large question for this type of format, because if we were to engage in advising them what to do, we will have to go step by step. But my general opinion and advice is no large gatherings at this point for anyone, especially in January.
Sure. So
OCPS is considering having a homecoming parade and dance. Does the district support having school-sponsored parades and dances at this point? And how do you distance during a dance?
So many of our schools, our principals and high schools especially, are working with their student governments, their senior classes to determine what the next semester will look like for them. A lot of them will miss out on traditional activities that were so important to many seniors and things they look forward to. And I think having those discussions now help them talk about potential alternatives, what they can do in this time versus what they maybe can't do because of social distancing requirements, because of CDC guidelines, because of what the Florida Department of Health advises, and because of what the district health and safety manual allows. Any proposal that comes forward from a school principal, will be vetted through our district safety and emergency management group and will be elevated to the executive policy group to ultimately decide what every school will be able to do that maybe pushes the envelope on some of those requirements, but we know that there are certain requirements, and within those, they can do those. And I think they're working through that right now. I think Winter Park is just an example of what principals are doing, but I think it's important for our students to know that that's being worked through and that they feel valued through that process. And I think the principals are doing a good job in trying to make that happen. So,
Thank you so much. This is our final question from Ryan Lynch from the Orlando Business Journal, and it's for Comptroller Diamond. What factors are informing how the final 2 months of the calendar year may look like for TDT collections. Are those becoming more clear?
Well, they're starting to, as far as what's going to determine how we do for November and December. I think one thing is obviously what's the positivity rate here? What's the positivity rate where people might be coming from? People are going to be less inclined to want to travel if rates are high, and they'll be more inclined to want to travel if rates are low. I think confidence about the vaccine, although I think you may have some people that say, you know what, we were thinking about coming to Orlando in November or December, but why don't we wait until we all get vaccinated? I think that's something that might be out there. And then obviously, can people travel right now? Is it something where they can get the time off from work? Is it something where are they still working, or have they had issues at work? Is that something that, with the economy, a lot of people have lost jobs, are still out of work. Businesses have really been hit with slowdowns. People have had their hours cut. So I think you have to sort of mix all that together, and that'll give you the answer. It's something that we've had a very good trend. Like I said earlier, we've had six increasing months in a row. And hopefully November will be number 7 as far as the increases. And, this past month, I think it was a 10% increase over the previous month. And hopefully we'll continue to see more and more increases as time goes on.
Deanna Albritton, Channel 9. Sorry, one last question over here. It's a kind of two-parter split between Mayor Demings and Dr. Pino. Dr. Deborah Birx on Sunday was pretty critical of governors throughout the Sun Belt not taking what she said was enough action to curb the virus. So for Mayor Demings, do you feel like there is more that you would do, or that your hands are tied currently by the governor?
What I have tried to do is make certain that the actions that we take here locally are based upon our local experience. I do have to work within the framework of the existing laws in Florida, as well as the existing executive orders issued by the governor. But I believe that it has allowed us to do some things that perhaps some others had not done. We, as you know, were first county to actually institute compliance of strike teams. And now we have worked within the current framework to assign fines to businesses. So I think that's the right approach, the right adjustments at the right time. We want to be timely in our early intervention and prevention-related efforts to stop the spread of the virus. Dr. Pino has been really clear here that we're on the precipice of going over the edge if we didn't act early in a timely manner. And so that's what we have done. These things, while our numbers are still relatively low, I think he's been clear in saying to you that there's a lot of danger ahead if people during the holiday season continue to congregate while either at home with multiple family members or others, or in large crowds. It puts us in a place where we're very vulnerable to having the type of experience some other urban metropolitan communities around America find themselves in today, where they have exceeded their local hospital capacities and they're seeing catastrophic results. We do not want to be those cities. So I will say to you in conclusion that no, the things that I felt that we needed to do here, we have done. We have a facial covering executive order in place. As you know, there is not such a statewide executive order in place. So I have not wanted to, as a local county mayor, be inhibited by the governor's actions or inactions. We have tried to be deliberate in how we make decisions in this county with some of the most competent health experts anywhere. And so I appreciate the work that Dr. Pino and all of our healthcare providers here provide to me. They are giving advice. I have a daily conference call with private healthcare providers like Advent Health and Orlando Health and HCA, who are giving me advice based upon what they see on their daily census of throughout the region here of who's in their hospitals. So when we take the sum totals of all of that information, it results in the decision-making that you see manifest itself when I come to these press conferences.
And so I guess for Dr. Pino, do you feel the measures that you've worked with the mayor on are sufficient? One of the things Dr. Birx pointed out is that, you know, across the Sun Belt, there were more restrictive measures when we were at the same number of cases back in the summer than we see now.
So I didn't see her comments, and I don't know about other states or the state of Florida. I'm limited in my scope to Orange County. I'm an employee of the state, and my role here is to advise the mayor and others on how to proceed. I do not make policy. So my input in that type of activity is insignificant, to be honest, at the state level. But I would like to say that every time that I don't call the governor, but every time that I call the state health department or anyone in the state, we have received all the funding, all the help that we need, and it has not precluded us in action or actions at the state level from providing the services that the county needs.
Okay, with that, I think we have responded to all of the questions. Thank you all for coming. Thank you for helping to spread the word about the various initiatives that we have in place, and we'll talk to you later this week.